Assalamualaikum and hello everyone. I hope you are having a great and blissful day. My name is Azian and today I will talk about the development of PET-CT scan in relation to nuclear medicine. By the end of this video, I am very hopeful of you to gain some knowledge about the topic. Let's go! PET is an abbreviation for positron emission tomography, where energy detection is given by decaying radioactive isotopes to build images. The first ever PET camera was built in 1973 by Edward Hoffman, Michael M. Terpagosian, and Michael E. Phelps at Washington University. However, surprisingly, it was not until 1977 that the first PET scanner that can scan the whole body appeared. Due to the advancement of technology, there are more than 400 PET scanners are used around the globe for medical purposes. CT scan, on the other hand, is an abbreviation for computed tomography, which was invented in 1972 by an engineer in British, Godfrey Hounsfield, and South African physicist, Alan Cormack. First clinical scanner was issued and installed between 1974 and 1976. The technology combines X-ray images and computerized to create cross-sectional images of the bones, blood vessels, and also soft tissues, which is more detailed than the normal X-ray scan. The PET-CT scan is literally a PET scan done along with a CT scan. It works by detecting the radioactive tracer injected, normally and commonly fluorodeoxyglucose 18, or also known as FGD18. FGD18 is a radioactive sugar which will be absorbed by the cells. Cells areas that use more energy will absorb more of FGD18, and cancer cells normally use more energy. Thus, the absorbance of FGD18 will be high around the cancer cells area. CT scan will then take X-rays of the whole body, and finally, PET and CT images will be combined, which show abnormalities that can indicate cancer or even tumor. In Malaysia, PET-CT scanners can be found in hospitals for scanning abdominal cells inside the body. Siemens Healthineers is one of the companies responsible for PET-CT scanners in Malaysia. They have been developing healthcare machineries on par with the rising technology. In this part, I will explain about the objectives or goals for PET-CT scan in nuclear medicine. PET-CT scanner is designed to offer more significant advantages over the separated PET and CT scanners. The patient will be stationary in one place while both scanners are working between the two acquisitions. In the case of some types of cancer, this scanner helps in finding the cancer and study its exact stage to describe the location of the cancer cells and how well spread the cancer is. The practice of nuclear medicine is used in PET-CT scan, where a small amount of radioactive material is needed to evaluate the situation of the disease. In this case, it would be cancer or tumor and any other abnormalities. PET-CT scan can also assess the efficiency of treatment or tissue metabolism and viability in one's body. Other than cancer, the scanner can also identify any abnormalities in organs such as heart and brain. The combined scanners of PET and CT will advocate in determining atypical metabolic activities and also come up with detailed diagnosis to be compared with when the two scanners are performed separately. In some cases, scanning of cancer after treatment may show an area where there might be some cancer left. However, it might just be scar tissues left over from the demolishing of cancer. The PET-CT scan can be used to identify whether the tissue is active cancer or just some scar tissues, thus making the scanner very useful in medical sector and proving that nuclear medicine can be developed into something very beneficial to mankind. Next, what is the latest and recent discovery of PET-CT scan? In 2020, during the COVID-19 pandemic, which has taken quite a number of lives, there have been some research reported that PET-CT scan early scanning led to the discovery of SARS-CoV-2 pneumonia, although patients denied they contacted the virus. The patients only reported symptoms of diseases other than COVID-19 symptoms. They were injected with FDG for PET-CT scan, but the FDG uptake by the cells was mild and the images showed clear scanning. They were then referred for COVID-19 testing via nasopharyngeal swab and were tested positive. Although the early findings of how the injection of FDG in body and scanning of PET-CT can detect the viral infection of the COVID-19 virus, researchers found that this method cannot be used and not recommended to be the first choice in detecting and diagnosing infectious diseases like COVID-19. Some of recent research regarding COVID-19 also accidentally identified the existence of the virus on routine record in performing FDG PET-CT scanning. Particularly similar to any process of indicating the inflammation, the affected lung areas will give a demonstration of increased FDG uptake. In recent article published in the Journal of Nuclear Medicine, out of 65 patients undergoing routine FDG PET-CT scanning, 6 of them showed unexpected discovery of pneumonia on the CT images with visible areas of the uptake FDG on the PET. Out of 6 patients, 5 were eventually diagnosed with COVID-19 by reverse transcription polymerase chain reaction (RT-PCR) test. All patients in this batch who undergone the test were asymptomatic. So, that's pretty amazing, right? COVID-19 has really taken the whole world into a state of shock. Thus, the advancement of technology is demanded to continue developing ways to put an end to the misery. So that's it. That is all from me. It can be concluded that the combination of positron emission tomography and computed tomography (PET) and CT scanners have been scientifically proven to be the success of nuclear medicine in detecting cancer, tumor, or heart and brain related abnormalities. Although both scanners have insane probabilities of success, the advancement of technology has brought the nuclear medicine instrument to a new level. The use of radioactive sugar fluorodeoxyglucose 18 (FDG18) has enormously contributed to the detection of abnormal cells. Although there might be some risks of radiation, past studies found that the radioactive material used is in small amount, thus less radiation contacted. Past studies have also proven the efficiency of PET-CT scan where the benefits are greater than the risks posed. Therefore, this can bring us to a new conclusion of how important nuclear medicine is in the medical services. The need of such technology can contribute to massive findings, especially in this time of pandemic. As an example, the studies reported by researchers regarding COVID-19 detection by PET-CT scan in 2020. To wrap everything up, I want to thank everyone who stayed from the beginning until the end. I really hope the knowledge I deliver today will benefit any of you. Thank you for watching and goodbye.